intention here was to bring together various sectors across the province and Canada to really focus on simulation and how we can use simulation in different ways.
Hey, are you okay? Are you okay? Carter, I don't have any response for him. I'm going to pull C-spine. It looks like he fell off his ATV. Are you getting a
CAMS though has a state-of-the-art center, and we really want people to see what we have for a center, but also for what we have for research, innovation, and interprofessional education capacity as well.
Simulation is the future of healthcare and education. Students get an opportunity to sort of measure twice, cut once, practice their skills in a safe, secure environment, make mistakes where it's psychologically safe, learn from those mistakes before they start interacting with patients out in the real world.
The more we can simulate, the more we can get them in realistic scenarios and with patients, with actors, etc., with models. I think that's going to make our workforce more talented. I think they're going to be ready to take on challenges, and that's really exciting to see.
NAIT has reached out to partners outside of the simulation community. They've brought in the health innovation community. They brought in business development, they brought in students, they brought in technology, they brought in policymakers, they brought in legislators and regulators and accreditors to understand what simulation is, so to demystify it, but also to help these different parts of the health ecosystem understand how simulation plays a role in what they each do.
This is one of the first times that these three groups, including ministry, academics, and healthcare technology, are coming together to align on the future of simulation and how simulation can be used to improve innovation in medical devices, as well as improve the quality of our healthcare practitioners that are graduating from programs today.
I think this event was a really fantastic way to meet a whole bunch of people in one place that are associated with simulation and healthcare technology. This kind of expertise is really useful for our innovators who are building new health technologies, to be able to test them out in almost real-world type situations.
Just seeing that there's a massive community around the space, there's a lot of people involved, whether it's in the educational side, the workforce development side, or the innovation side, and then how those all bleed together and really complement each other nicely is really the key for today's event.
I think people have talked a lot about the silos that all of these various, stakeholders have, and I think it's important that we all go to more events like this. We work together to make sure that we move healthcare forward and we deal with the challenges that we're dealing with in Alberta and beyond.
Events like this bring together groups that otherwise wouldn't commonly be together to acknowledge that we share similar challenges and that we're steering our ships in the same direction, which is the direction of improving healthcare and improving patient outcomes.
I think more connection between industry and academia is necessary. Building people who have that strong background and core in a specific disease in a specific area is really important to connect with people who can actionize that. So how can we get it into the hands of the people who need it?
I think the biggest takeaways from this event are the importance of simulation in healthcare and how simulation can be used for enhancing education for students, for workforce development, and also for helping support innovators bringing their products to market and testing new ideas, prototypes in a safe, simulated, realistic environment.
We all have a vested interest in having the best healthcare system and the best healthcare workforce possible.